you guys for joining us again for another video here. Today we're going to be going over a topic, something that we saw in the news yesterday. Today it's in the news about a drug. He's going to pronounce it for me because I've been botching it.
Molnupiravir.
Molnupiravir. Say that 5 times fast. But yeah, it's a mouthful. So, but it's a drug that was brought out during like the height of COVID. We could say that. 2021, I guess, is when it actually came out, I believe, and it was used to, or created to reduce symptoms, to advertise to prevent hospitalizations and decrease death, the probability of death. And so there's some benefit to it for sure, but there is an article and a study that came out now, it's in the news, that talks about the negative effects from it and some mutations that it's possibly creating. And so yeah, we just kind of want to talk about that and how, these things are kind of, it's difficult to process and to handle these things. So we want to talk about that and just kind of go through this process.
Sure. Yeah, so, it's an antiviral, which evidently has the mechanism of producing mutations in the nucleic acid of viruses in order to make them dysfunctional and therefore not allow them to replicate and evidently propagate. I guess what this one article has found is that there are some mutations that are not causing that virus to completely shut down and are being passed potentially from person to person, which begs the question if it could potentially make a mutation that makes it more transmissible or aggressive in its outcome and infection to patients. I think that evidence is not out there yet. But what it does bring up is the topic of unintended consequences of actions. So as we've seen with COVID and with all the things that have happened the last 3 years, there are consequences of everything we do as a society and everything we do as an individual that then play out in our life. This is just another example of, hey, gosh, it may have some positives. Molnupiravir, I know we're not utilizing it in our management of patients with this infection, and we've had excellent success. I would say a recovery rate of 100% for this infection. Point is many people have different ways of managing patients, and I think that's the beauty of medicine, is it's not a one size fits all. There's many ways to take care of a patient, and that's kind of what I think a part of what we do here at Health Truth Life is empower patients and recognize that, hey, we're going to work with you with your own individual parameters, risks and benefits, but then also get out information like this that says, hey, we want you asking good questions about everything you eat, everything you drink, everything you allow in your mind, and everything you do with your body, because it all plays a role in your predisposition towards health or disease. So, obviously unintended consequences are a big thing of what happened over the past 3 years. Good example, isolation and compulsory masking of kids. I think there's evidence, and there's some many physicians and scientists who believe that it has led to the potential of increasing developmental delays and social issues with young kids, whether it's fear, anxiety, depression, drug use drug addiction went up during the isolation and components of this pandemic. So these are things I think need to continually be talked about, the unintended consequences of these things.
A lot of people don't, you're not going to hear about it, a lot of it in mainstream media, it's kind of being swept under the rug, but there's a lot of destruction and negative things that happen as a result of the attempt to go through what we've been through the last few years. So that's what I love about what we do, like you said, empowering our patients to ask questions. So we encourage you guys, ask questions. Don't just take the first solution that's being promoted and pushed and say, hey, this is it, we have to do this.
And truth doesn't mind having questions asked. And I guess that's what I say, like, gosh, and I believe that for God. Like, I think God's big enough for our questions. I think truth is big enough for our questions. And if you want to know the truth and you seek with your whole heart, you'll find it. Knock and the door will be open unto you. Seek and you will find. So I say seek and knock during this time. Really, about everything that we're hearing, because people are saying the world's upside down, and to a certain extent it is. But it's not if you recognize where truth comes from. Then you recognize that there's deception everywhere.
I don't think you can find truth and find the answers, obviously, without asking questions. You know, so you have to you can't be found unless you know you're lost, and once you know you're lost, you have to respond by asking questions, seeking truth.
Great point.
Mm-hmm.
So for any of y'all that are lost out there, have components of feeling lost with questions of what's going on, all the media questions, these types of articles talking about the unintended consequences, man, seek truth, seek his kingdom first. That's what I would say with all this. And take care of your body like a temple, because it's a temple of the Holy Spirit through this time.
And to add on to that, there's always hope. I know we've seen so much, like you said, depression, suicide rates. I mean, all these things are kind of gone through the roof the last few years because of the lockdowns, because of everybody being so focused on the news and media and the negativity of what's happening. But there's always hope.
Always hope.
Always hope. It's always there. God's always available. You can always reach out to him, and he's approachable, like you just said. You can always ask questions.
The veil's torn.
Yeah.
We'll have a link to a previous video we did back in 2022 on cold and flu season empowerment. So that'll be at the end of this video. And we'll have also a link down below with some information, a document discussing how to be empowered during an upcoming viral season. So we appreciate y'all. Thank you very much. Like and subscribe.
Thank you.
And thank you. We'll also have another Matrix concept coming out in a few days. Be on the lookout for that, mindfulness. So have a great day.
All right, you too. Thank you.